Now it is my pleasure to introduce our keynote speaker, Mr. Omar Passons. Omar Passons is the Director of Integrated Services within the County of San Diego Health and Human Services Agency. Integrative Services focuses on housing, homelessness, and includes economic growth to ensure every San Diegan can attain the Live Well San Diego vision of being healthy, safe, and thriving. Omar is a former construction and land use attorney and has long been active in San Diego civic affairs. During his career as an attorney, Omar worked on issues ranging from National Environmental Protection Agency clearance to entitlements and land use disputes. He also worked on community development and in a part of southeastern San Diego that was directly negatively impacted by environmental contamination. Omar grew up in San Diego County's foster care system and brings a unique perspective to leadership on homelessness and economic opportunity issues in the region. In addition to his work on the systemic impacts of redlining and discriminatory housing policy, he has spoken to the importance of strength-based leadership, empowering teams to succeed, and fostering psychologically safe workplaces in which workers can thrive. Please join me in welcoming Omar Passons.
And thank you again for that introduction. I appreciate it. I'm excited to be here. I'm going to go ahead and share my screen now so that we can chat just a bit. Just give me a second to get there. And there we go. So I am grateful for the chance to come and speak to this group. You know, Katie mentioned that I spent a good chunk of my career. I was an attorney here in San Diego doing a range of land use and a little bit of environmental work while at Caltrans. And I'm grateful for the work that you all do. Frankly, I have found a passion and a life calling in serving people, especially those who are poor at the County of San Diego, and look forward to talking more about that. This talk and this day and this work that you all are doing and that the leadership of AEP is doing is so critical, not just right now. It's critical, as you'll see, for a good chunk of our history and for what we do moving forward. So I wanted to start with this picture. This is 4-year-old me. And the reason that I put this picture up is that not just I love that suit, right? And that hair, which obviously I now have more on my face and less on my head. But I put that picture up because it is the 4-year-old version of me, right? The Black, Indigenous, peoples of color in San Diego County who are most impacted by what we're going to talk about today. The 4-year-old version of me had childhood asthma because my biological mother, who was mentally ill, was assaulted and I was born early. And my underdeveloped lungs were in a part of our region that struggled because of the environmental challenges that we'll talk about today. And so over the course of this next half an hour, I hope you'll have in mind, not just this little guy, right? The little kid who went to Head Start with the slick suit that I wish I could find, but other children like that today who are around you and your children and the children of your friends and colleagues. Today, we're going to talk about 3 things. Really understanding equity, past and present. What that actually means in context, some data, some understanding of how it relates to the San Diego region, and then that'll help us get to looking forward. What you can do at work in your context as environmental professionals, what you can do at home. And that's a really important one that I'll get back to in quite a bit, but to understand that our obligations and opportunities extend beyond, where we are, in the moment in our jobs. Before we get started though, our wonderful administrators are going to help us do a quick poll. And so I'm going to ask our administrator to step forward. We've got 3 quick questions just to help us get started. The first question, my work is primarily in, and then if you could just go ahead and select right from your screen, government, private development, community organization, academic, or other. We'll just give it about 15 seconds and give folks a chance. Try to make it a little interactive because of where we are and this new reality when we can't interact, we can't sort of really embrace each other in physical space. So let's see what does our audience look like? Let's see what the results of that first question were. Okay, quite a lot of folks who are either in government or working with public clients. That's good. I see some of my developer friends from years past, folks who are trying to help increase our the supply of housing that we've got, which is important. I'm glad to see, always glad to see community organizations represented and stepping forward. And then we need our academicians more than we sometimes realize. Let's go to that second question, which is this: how many of the 3.2 million San Diego County residents qualify for our social safety net, CalWorks and CalFresh and things of that sort? Is it less than 250,000 people, 250,000 to 500, 500,000 to 1 million, or more than 1 million people? What do you think? Again, we're going to give people a chance to ponder. It's a lot of people in our county, in our region. Our county is the size of the state of Connecticut. A lot of people, a lot of diversity. Let's go ahead and see what the results look like. Okay, we've got, looks like the highest answer here so far is the 250,000 to 500,000. This slide is something I want folks to think about as we move to the next poll question, the rest of the presentation, the rest of our talk, right? That's our perception and then our reality. The real reality is that last line. Over 1.1 million San Diegans in our county are poor enough to need a social safety net service. So just remember that as you're going through the rest of this. And then finally, one last question that will make a good point. When did US courts stop legally enforcing racial covenants that banned Black people and others from living in many high opportunity communities? So 1905, 1948, 1972, or 1991. And we'll just give that a second for folks. Okay, let's go ahead and pop up that answer. Okay. We're gonna press pause on that answer. I'll leave it as a cliffhanger because I will get to it during the presentation. So hopefully it's a little chance to cross-check your own responses. Okay, thank you for doing that poll. I appreciate it. This talk, the spirit of what AEP San Diego chapter is doing, this recognition that racial justice is environmental justice, it's a foundational concept that I hope you'll see as we talk through this more is really very true, especially in San Diego County. One of the first things to appreciate about it, right, is that we'll cover issues that are linked, and your ability, your willingness to address environmental justice is directly related to our community's ability to really address racial justice. I put this quote as a threshold start. It's the title of this presentation, my talk, A Pileup of Inequities. There's a gentleman named David Hewitt who runs the Office to End Homelessness in Hennepin County. One of the things we like to do as county officials is try to work with our colleagues to learn and listen and develop. And the Pew Research Trust, a fascinating study that you can find on their site, but in San Diego County, it's reflected in the fact that African Americans are more than 5 times overrepresented amongst our region's homeless population. And that's something to realize when we talk about how do we get to real meaningful equity. Understanding the data is important. So let's talk a little bit quickly about some data. Neighborhoods within 2.5 miles of a facility that emits localized greenhouse gases, 22% higher minority population than those beyond 2.5 miles, 21% higher poverty rates. And then if we bring it home, again, bring it into San Diego County, in 92113, that's a sort of southern portion of our community, asthma hospitalization rates, 92.9% of the entire state is lower on that list. And what do we know about that community? 78% Hispanic, 12% Black, and almost 2/3 of the renters in that community cannot afford basic monthly rent. These are the types of issues that we're facing. We talk about data, right? We want to understand the context. This is exposure. This is pollution exposure in relation to how much pollution we actually generate. Latinos are exposed to more than almost 2/3 more pollution than they generate. African Americans, it's about half as much, or 50% more. And then you look, non-Hispanic white Americans exposed to 17% less pollution than they generate. Environmental justice and racial justice are linked. So what are we going to do? I'm going to frame some historical context for us so that we understand that yesterday's choices impact today's challenges. These are not independent concepts. And so let's have a look to understand. We'll start with an example. This is a red line map of Richmond, just a level set. This was part of a series of maps that our federal government created in the 1930s. It was reflective of what the local real estate industry thought about various parts of a community. And importantly for our purposes, what parts of the community were more desirable to guarantee loans, to drive investment, and what parts were less desirable. And one of the key factors was the presence of those red communities that you'll see, is the presence of Black, Latino, foreign, right? These were the hazardous conditions that many communities discussed. In 1948, 7 years before my mother was born, the Supreme Court in Shelley v. Kramer rejected racially restrictive covenants. If we just think for a moment, how many of us had family, ourselves were alive at a time in this country when people were forced into certain communities. That's an important distinction as we move through these slides. It's not just about where banks wouldn't loan. It was about local decision-making and our court system. For the next few slides, I want to just focus on this particular red circle, which you'll see is just, it's mostly an area that was in Richmond, part of that initial portion that was redlined as most hazardous. Conversely, just to be mindful, the blue and the green, which are a little further out in this map, represent desirable places to invest. So now we move to tree cover, something as environmental professionals you're all very familiar with. This map series that I'm showing is part of a really incredible New York Times piece that you all can find by Nadja Popovich and Brad Plummer. And just to level set, the dark green is high intensity tree cover. As you move a tree canopy, and then you move to the light green and white is essentially no or minimal tree cover. What does that mean? Well, we'll come in just a second to make the point, but here's another one. So this is paved surfaces. As environmental professionals, it's not just about nature when you're doing the reviews that you're doing. We know how pervious surfaces can be impactful for stormwater. But there's another way in which these pervious surfaces, this asphalt, creates real problems. So here we've got the highest concentration of asphalt in the community, in the same area that was redlined, in the same area that does not have sufficient tree cover. And predictably, what do you get? The hottest temperatures in the region, right? This is a thing that drives home the point that these decisions in the 20s and the 30s and the 40s and the 50s, they contributed to this environmental inequity that we see here. But let's be clear, this is not just a Richmond problem. This is San Diego's red line map. That square in the middle, you can see sort of tilted a little bit, that's Balboa Park to frame your field of what you're looking at. You can see, the 92113 community that I mentioned earlier is largely in a portion that we as a community, right, got into that sort of red line zone. And I say we as an important point, because most of us weren't alive there, but just as we share in the benefits of society today, we share in some of the burdens that our society created together, all of us. But here's the point I want to make. I talked about that community, but this is an actual advertisement in San Diego for Loma Portal. What do you see? That was here in San Diego. That's part of the context for moving us to this next series. This is a map of the San Diego's area deprivation index. And the reason that I share these next 3 slides is to build a context. This is very valuable for you as environmental professionals. When you're talking about how do we really look at working our way through environmental justice, you can use this information to understand the economic inequities that exist. You can probably guess, but the darker blue are the communities that are least deprived economically, and the dark red are exactly the opposite. And using this information together with listening to members of the community can really help drive better decision making. Similarly, and this is one that's really important in the context of COVID-19 and the pandemic, this is the San Diego portion of the Healthy Places Index. The state of California has produced an incredible and robust piece of information. You can go to this site, you can zoom in wherever you've got a project, right? And as you help your clients think about development decisions or working with municipal clients on plan updates and things of that sort, this is a resource, and it's an important resource because the state of California, in the context of public health, has said to meet your obligations as communities, we are going to require that you focus on those communities that are most impacted, that are disproportionately impacted by the COVID-19 pandemic. And this is a slide that can help you get there. And then this is one I'm sure is one that you all have bookmarked on your desktops. It's the CalEnviro screen, right? Red is the highest pollution concentration and green just the opposite. And the point I was getting at is that those last 3 slides, right? They provide this economic and health and air quality information that can help you use a free resource, which I know your part of the build budget is never one of the revenue producers, right? So you got to look for how can you get help wherever you can. Our public entities are creating huge opportunities and value for you in working with your clients. So what have we done? We've had a talk about the data, some of those issues. We've looked at the context that we're in now, right? And now we can start to talk about what you can do, right? Moving forward. 2 quick points. I put this slide up and I'm going to leave it up for just a moment, give you a chance to read. And I just want to highlight that last sentence. This is the professional obligation of AICP certified planners. We shall urge the alteration of policies, institutions, and decisions that oppose such needs. Now, I'm in a room full of planners, so I know the distinction between may and shall is not lost on you. And that's a critical point. This is an obligation that you have moving forward, working with clients. And now as we talk about another key concept from my world, understanding the social determinants of health, right? These are concepts and constructs that help us understand that inequities are driven by where we live and work and play. And this is a great image that the Barhai Initiative in the Bay Area puts forward so that you can see how these things are interconnected, these social inequities and institutional inequities. And then a big part of where you come in, right? The sort of the living conditions. How do you help use these tools? A fair amount of these tools that I'm sharing now, I will also link. I tend to use Twitter quite a bit. So there'll be, if you go on this afternoon or this evening, there'll probably be quite a few of these listed right there for you to consider. Another piece of background knowledge before we get to what you can do specifically at work and at home. This is the California Health and Safety Code makes it plain for you. One of the challenges sometimes that governments have, if they haven't been dealing in the world of health equity, right, is, well, how do we define that? How do we have a common definition? In our state, our legislature has made it easy. That full and equal access language is sort of the touchstone, right? It means that efforts to ensure that all people have full and equal access to opportunities that enable them to lead healthy lives. This is the piece where part of that environmental justice and racial justice and sort of health equity all meet. And another piece that comes out of the work that you all do, when you start thinking about how do we process these environmental justice elements, is the notion of cumulative risk. Right? And now in this context, when we're talking about cumulative risk. Think about it back, we were just talking about social determinants of health a couple slides ago, where we live, work, and play. Environment is not just about tree cover, it's not just about paving, it's also about the economic conditions, the safety in a community, right? All of these factors, they work together. They impact what happens in a community. And as we look at, right now, switching to what you can do at work, you'll see that there's a couple places where this notion of integration of these different concepts really comes through to bear. So what can you do? I've been on both sides of the community engagement question, right? Like as a president of my town council in my neighborhood, as an advocate for clients, as a land use attorney, as a government official going into communities and trying to have civil, if passionate, dialogue about developments that need to be done to create opportunities for people. You can do those same things, and many of you already do. But I want to stress something about that community engagement. It's got to be early. If you may not have something coming for a year or 18 months or 2 years, it may not even get to the permitting stage. The opportunity, especially if you have government clients, to help them think about, hey, how do we do this work before there's an actual project? It's a challenge because people want something to weigh in on. But on the other hand, it gives you the chance to really say, you participated in what we're doing. You're invested in this. And it has to be ongoing throughout the process and really authentic. And I want to mention that not only do you have a chance to work on the community engagement side, but also with other civic leaders like your elected officials. And here's one concrete example. So I work for the County of San Diego. Our chair of our board, Supervisor Greg Cox, Council Member Mark West in Imperial Beach, right? We're part of this delegation that went to DC with the backing of community members and professionals like yourselves and said, we need resources. And they got over $300 million to ensure that the sewage spill issue that we're facing at our international border, that was directly impacting a community that is facing environmental justice issues, got the resources and support that it needed. That's an example of a way that you can partner to help drive those conversations forward. I work for the County of San Diego, and the county actually has some meaningful opportunities for you as well. Our public health services department has an Office of Health Equity that really focuses on driving the conversation and framing data and information that you can use. And similarly, our community health statistics branch actually has just vast washes of data that can help build meaningful connections between these different pieces that we talked about. And when you get to, right, sort of an integrated approach around the environmental justice elements, I want to skip right down to that last dot point. This comes right out of the required portions of the environmental justice element. Improvement in programs that addresses the needs of disadvantaged communities. That's kind of a catch-all, right? But also, if you think about this integration concept that we've been talking about, right? That's the catch-all that allows you to take the health data and the environmental data and the safety data, right? And the economic data and say, this is all part of of getting to environmental justice. I want to encourage folks to go beyond the minimum when they're doing their environmental justice elements, right? When you're thinking these things through, there are a couple of areas, climate vulnerability and climate resiliency, they're not mandatory parts of that environmental justice element, but they create a real meaningful opportunity for you to say, how do these climate-driven hazards make this community more vulnerable, less resilient? And what is it that I can do? Right? Remember, that shall does a lot of work. It's no longer a question of, well, I'll try. How do you make sure your client is paying attention? This is one of those sort of the gentle pressure that you have the ability to apply. As we move towards the end, I want to also talk about what it is that you can do at home. And there's a number of ways to think about this. I'd say there's one that's almost a hybrid between work and home. And it's what you do to diversify and empower those with different lived experiences, right? If you're a senior official at your company who happens to be white, what are you doing? Not just to say, hey, we have an open policy and we're going to do our best and we'll see what happens, right? And maybe there'll be some people. The scholarship that you created is an example of doing more. Sponsoring junior staff, creating those opportunities in those doors, right? That's an example. I know that as for myself, as a former practicing lawyer, one of the issues that would sometimes happen in the workplace is you have a lot of male senior partners. And so the success for a big win was, oh, let's all go out and get cigars and have scotch and stay out till 11:30 at night. I know there are plenty of women who like cigars and scotch. So I'm not like the point is not that there aren't. The point is that those same senior leaders didn't take the time to say, well, what's going to work for the bulk of my workforce? And similarly, when you're thinking about creating and expanding diversity and inclusion, you've got to think about what's going to help elevate people's voices, not just to higher positions, but where they're actually respected and listened to, where they don't get second guessed and you don't realize, well, maybe I have an implicit bias here. So what are 3 things that you can do yourself? Share, right? When you get home, or I guess in this world, when you get off Zoom, right? Talk to your friends and family about this data that you saw today. You'd be surprised how many people don't really understand what some of the things that happened in the 20s and 30s and 40s, how those really impact today's inequity. That's something that you can do to help people. Oh, this little one's having a rough go of it, but it creates an opportunity here also where you can listen without judgment to your friends. A lot of times we get into a place where we're stuck in this bizarre loop of you're wrong and you're wrong. Sometimes it's good to just listen and to create that opportunity for people to share, and then pick how you frame the environmental justice components for people and help them see those real differences. And then you have the opportunity to act. One of my staff told me after the recent protests that had happened in La Mesa, she took her kids out to walk around and they had these conversations about specific areas. Get in your car and drive to the 60 miles of San Diego area that is unpaved, right? That's right now dirt roads. So I really want to encourage you to find ways to act. And then, sorry, a quick word as we wind down here about the county. Our environmental justice and equity components are central focus of our climate action plan update. And even as it moves forward, you saw that there was a vote recently that part of the work that we do will continue to animate and drive that cross collaboration, environmental and economic and social justice. And then just some final thoughts as I wrap up here. I was born to a mentally ill, disabled mother who gave birth to me 10 weeks early when she was assaulted. As a result, I was born 2 pounds, 8 ounces. And you can't tell here if I were in the room. You'd see I like food. I feel that okay. It's fine. So I've recovered. But those circumstances made some of the environmental challenges worse because I had childhood asthma. Thinking back to that image of that 4-year-old kid with the little afro, right, and the fresh suit. How do we make sure that you can push for a better, more inclusive, more just and equitable community and society? You're limited as you go forward only by the courage of your convictions and the breadth of your imagination, even in the role. So whether you're a frontline worker or you're at the tail end of your career and a seasoned professional, you have the ability to make important change, the power to drive important change. And I think that this example, as I close, I'll just say, your work in creating a scholarship your work in doing the hard work yourselves and not relying on others to explain racial justice. Your work in being committed to changing the narrative, not just today, not just in this moment or this season, but fundamentally altering the way we do our work. That's what's going to matter in the long run. So as we close, I'll just say I'm grateful for the opportunity to have shared this time with you. As I mentioned, I'll go ahead and post some of the links in my own Twitter feed, which is just my name, Omar Passons. And I'll leave this quote as we close out here. I'm not going to read it. I'm just going to highlight the part that's bold, that fierce urgency of now. That's critical. Sometimes we hear, oh, the government, they don't think in those terms. They're not, like, I'm here to tell you that when I go to work, my colleagues are committed to trying to push now for changes, trying to push now for support. And I hope that you'll consider doing the same as you move forward in your lives and your careers. Thank you very much.